Welcome, everyone. I think we will go ahead and get started here. My name's Rex Force, and I'm Vice President for Health Sciences here at ISU. And I'm joined by quite a few other folks from the Division of Health Sciences, including some of our deans and associate deans that you'll be hearing from. This is kind of a fun experiment. This is the first time we've done this with alumni and friends of the division and of our College of Pharmacy and new College of Health. And we'll see how it goes. We want to be able to get through some updates about what's happening here at the university today. And I'll be presenting some slides just that have some talking points about the division and the directions that we're going. And then we'll also have some presentations, brief presentations from Dean Walter Fitzgerald, as well as our associate deans in the School of Nursing and the School of Rehabilitation and Communication Sciences. We'll also hope to have some time towards the end for Q&A, and I know some people submitted some questions before in advance of the meeting, and we will try to get through as many of those, and if people have other questions, we will address those as time allows. We'd also like your feedback. So I do have a slide later on asking about how this worked, what we could do better, what kinds of information you're interested in, and that sort of feedback I think would be very valuable to the group. I'm going to go ahead and share my screen so that I can show my slides. So just give me a moment here. We're just going to spend a little bit of time talking about COVID-related impacts at ISU and the division, as well as talk about the reorganization of the Division of Health Sciences and why that came about. And right on the heels of that update, we'll talk about budget, which was one of the primary issues that led to our reorganization within the division. We also have some good news related to program growth for the health professions here at ISU, and I'll provide a little bit of other news and notes that has occurred over the past few months related to the Division of Health Sciences. And then I'm going to hand it over to Dean Walter Fitzgerald and Associate Dean Dr. Karen Neal and Associate Dean Dr. Chris Sanford to talk about their academic units as well. And then we'll move on to some Q&A after that. So one of the first things that I think we should celebrate are that we, even though our spring semester was interrupted, we were able to graduate and congratulate a lot of graduates across the Division of Health Sciences. And this is just a slide that talks about all of those graduates from our programs. Literally hundreds of students were able to graduate and graduate on time. We did have some delays for some of the programs that were significantly affected by COVID. And one of those, a good example, is our dental hygiene program, where we had to make significant modifications to our clinic and some of the activities that those students do day in and day out to make it safe for the students, safe for the faculty, and safe for the patients and clients that they serve. They didn't actually end up graduating until late July. And that did cause some stress for those students, for their parents, for job searches and that kind of thing. So there were some significant impacts for some of our students, but we really, I think, overall did a good job of seeing students through to the end under very difficult circumstances where their education was significantly interrupted, not just in the classroom, but out in their clinical rotations and the different sites that they do their training, because we're so dependent on so many sites for those kinds of partnerships. We have on campus a COVID health committee. I chair that committee, and it's made up of public health and other health professionals, environmental health, emergency management individuals on campus. We have put together, I think, a very robust plan with a lot of duct tape and baling twine and other things to put the plan together over the last few months to really do our best to have a safe and primarily in-person opportunity for students in the fall. We got a lot of feedback from our faculty and students about the need to have in-person instruction. And we've been able to be flexible with all of our course scheduling and create, I think, an optimal, even though it's suboptimal by normal standards, an optimal college experience for students that choose to come back to campus and be in person. Some students would rather be online, and we have options for them as well. So most all of our programs have been adaptable and flexible. We have re-roomed essentially every course, every section on campus for the fall to create social distancing where appropriate. We've put health exceptions in place where we can't maintain that distancing with hands-on activities and things like that. But we have, I think, quite strict guidelines and guidance for what's going on campus, and we're doing the best that we can to maintain a safe environment. This COVID Health Committee does contact tracing. It works hand in hand with the local health department. We plan those health exceptions where we can't maintain distancing or have other issues that create some difficulty for maintaining the right public health disease mitigation efforts. We do lots of different planning, and we do training and education for the campus community as well. The other thing that this COVID committee does is it sets the operational levels for the campus. We have a green, yellow, orange, and red operational status. Since we put this into place in early August, we've been in the yellow the entire time. But we have seen cases on campus. We typically see cases on campus primarily due to either living arrangements, because we've seen some in the dorms and some spread in the dorms, or off-campus activities. Students, faculty, and staff getting COVID infection from family gatherings, being out in social situations and otherwise where disease spread is much more common. We have not had, to my knowledge, to date, a single case where someone's been infected from another individual in the classroom, for example, which is, I think, very good news. I'm not saying it won't happen, but the point is that our strategies to try to keep students safe have thus far been pretty effective. We have had some spread on campus in other situations, such as the dorms, other work environments on campus. There's been a few cases, but for the most part, we are able to manage it up until now. We are seeing more and more cases overall that are, again, spilling over from the community, and our case count has been increasing gradually. I think the Labor Day holiday, we're still seeing some effects from people getting out and doing a lot of social activities over the Labor Day holiday. But overall, we've been able to manage this, I think, much better than a lot of other institutions where they have very, very high populations of students in the dorms. They have Greek systems that are very, very active, and students are participating in a lot of parties and social interactions. We don't have as much of that on our campus. And in some ways, although that's part of the college experience for many students, it's not something that's been a part of ISU traditionally. So in many ways, those kinds of things have been to our advantage as we respond to the COVID pandemic. I'm going to transition now and talk just a little bit about the reorganization of the division. On July 1st of this year, the Division of Health Sciences was reorganized into two colleges, the College of Pharmacy, which is the oldest college on campus, and you'll hear more about that from Walter Fitzgerald, and the College of Health, which is now by far the largest college on ISU's campus. The College of Health has all of the programs that were in the old College of Health Professions, in addition to the School of Rehabilitation and Communication Sciences, which used to be a college, and the School of Nursing, which also used to be a college. This reorganization was really brought about for several reasons. One is budgetary. There have been significant budget cuts that the university has had to deal with. even predating COVID, but made much worse with COVID. And so we have addressed some of those budget cuts with changes in our administrative structure. We also had last fall 3 open dean positions in the division, or soon to be open positions, 3 searches that were either ongoing or ready to kick off. And that afforded us the opportunity to look at reorganizing and consolidating and reducing some of the administrative costs associated with running the division. And that's in fact what we did. That was at President Satterlee's direction. And it was also, I think, prompted by a lot of not only the budgetary pressure that we just talked about, but also some political pressure related to administrative burden and administrative and overhead kinds of costs associated with higher education, just more generally. So this afforded ISU the opportunity to try to address some of those concerns. So as I mentioned, the consolidation of the division has resulted in a couple of changes in titles, but Karen Neal, who was our Dean of the College of Nursing, is now the Associate Dean in the College of Health and Director of Nursing Education in the School of Nursing. Chris Sanford, who you'll be hearing from a little later also, was serving as the department chair of the Department of Communication Sciences and Disorders, and he stepped into an interim dean role as interim associate dean in the School of Rehabilitation and Communication Sciences. So you might be saying, well, who's leading the College of Health? We have an open search for that position. And so the search that is ongoing right now consists of faculty members, some staff, some students, and some concerned and very involved individuals from outside the university who are helping to perform that search at the present time. As of about a week or so ago, there were 28 applicants for that position. So we got a pretty good response in terms of those applicants. They're screening the top maybe 10 or 12 of those applicants, and we'll be doing phone interviews, and we anticipate that those phone interviews will be occurring over the month of October and maybe into November, and the top candidates will be invited to campus in the spring, hopefully in person on campus in the spring of 2021 for a start date likely in the summer. Usually around July is when we have people start. I wanted to talk a little bit about enrollment. Over the last 4 years, we've seen pretty stable enrollment within the Division of Health Sciences. These numbers bounce around slightly, but you can see for 2020, we're actually up 1.8% over 2019, which is really good. The rest of the university is down about 3.5%. A good chunk of that, though, is early college students. These are high school students that take courses here at ISU, and because of just the goofed up nature of even high school education, not all of those kids got enrolled in early college programs on time. So we may actually see those numbers move up a little bit as high schools get organized and these programs get more students enrolled in them for early college here. The other thing that happened over the summer, because we were very concerned about enrollment, is we really activated, and this was under Chris Owen's leadership, our Associate Vice President, we really activated the recruiting and advising process for students to provide them with reassurance and engagement over the summer. And our team of advisors and recruiters averaged 760 contacts a week from May through July with these students and prospective students to make sure that they were being communicated with, that they understood the plans for the fall and understood that we were going to do our best to make it a safe and productive fall, even in the face of COVID. So it was a lot of work that went into this program. We also, as I mentioned, endured some budget cuts, and across the Division of Health Sciences, you can see that we averaged about 5% budget cut. The first line, that Kasiska Division of Health Sciences, also includes our health and wellness programs on campus, and we asked that those be held harmless because obviously we were going to need a robust university health response to respond to student needs and faculty needs here on campus in the fall. And in fact, we did not have to cut the budget of university health through this process. That's one reason that first line there is not 4 or 5 or 6% like the other academic units of the division, because university health was a big chunk of that, and we did not cut because we didn't want to reduce services in the face of COVID come fall. We have a lot of growth going on in the division, and you can see just these numbers. I'm not going to read all of them, but many of our programs have grown significantly. We picked up a new group of students here in Homeland Security in our emergency management program. Homeland Security program at Concordia College was closing, and we were able to transition not only the students, but one of their faculty members into ISU to continue to provide them with an education and build within our emergency management team a new student base and a new program and a new faculty member to help grow. And that's the group that does paramedic science, and it does fire services, and it does emergency management. And now we have a program in Homeland Security, which has been quite popular. We also are looking at substantial growth over the next year, including standing up, and this is the last line of this slide, an occupational therapy program in Meridian to complement and to mirror the one that we have on our Pocatello campus. So that will be exciting. We're looking at hiring some new faculty beginning in January for that occupational therapy expansion. So there's a lot of good news, and we've gotten some really good news from several different programs, including radiographic sciences and our Masters of Occupational Therapy program that received grants from partners in the community to promote things like women's health or new skills and new skills labs in our neurological function lab. The Scottish Rite provides scholarships to speech language pathology students, and our Meridian Health Science Center received a $145,000 gift from the Sunderland Foundation for furnishings associated with our new clinic remodel over there. We're finishing up phase 1 of a multi-phase clinic remodel that'll have interdisciplinary clinical training opportunities on our Meridian campus, and that gift helps us with furnishing that with exam tables and chairs and desks and different types of equipment. We also received some really, I think, fantastic grants, and Bill Woodhouse, who's a family physician in our family medicine department, is the principal investigator of a nearly $2 million grant to look at improving interdisciplinary training and putting providers into rural areas that was funded through HRSA. Melanie Wright, who's a new faculty member in our College of Pharmacy, is a health services researcher and works with technology and the technology interface between providers and patients. Got an NIH grant of over $2 million. It's the only R01, that's the most prestigious type of NIH grant you can get. It's the only one on campus at the present time. And we were really excited when Melanie came aboard in the College of Pharmacy, and we knew that she had a fantastic track record for grant writing, and that has continued since she's been here. So that's an exciting project. She works with collaborators at Duke and at University of Utah and other places to look at the technological interface in healthcare. We had some outstanding faculty nominations, and Tori Sharp, who's in our Communication Sciences and Disorders Department, was recognized as one of the master teachers on campus. She was a finalist for that. Christina Blazer was a finalist for the Outstanding Service Award. She also is in our CSD department. And Danny Zhu, who's a researcher in our College of Pharmacy, was recognized as one of the outstanding researchers. Unfortunately, we didn't have the normal pomp and circumstance associated with these awards in the spring, where these folks are mentioned at graduation and at other award ceremonies. Unfortunately, that didn't get to be done. So I'm making sure to talk about it every chance I get in these types of events. In July, we also had the first group of psychiatry residents start with a joint program we have going with the University of Utah. These residents will spend their first 2 years down in Salt Lake and then come to Southeast Idaho for their last 2 years of training. The goal being to have folks that are interested in coming to Idaho will stay in Idaho and enhance the mental health care infrastructure for this part of the state and the state overall. Interestingly, this is already paying dividends. We haven't even had a graduate in the program yet, but 2 of the graduates that are coming out of the program now are coming to Southeast Idaho to be able to teach in this program and set up their practice. So it's already creating a pipeline, even though we haven't had a graduate from the Idaho track yet. And then the IRH has received a grant, that's the Institute for Rural Health, a grant of over $500,000 in the AmeriCorps program. And that's designed also to look at ways that they can improve healthcare infrastructure in rural areas. Lots and lots of our faculty have received impressive awards and recognition this year too. This last grant that I'm going to talk about is the GRIT grant. The GRIT grant from the PA program. What they've done with this program is set up some scholarships for students that are coming into the PA program from the ISU and the College of Idaho. And it is an early assurance program whereby they can be admitted as a junior or senior in college, have scholarships waiting for them when they come into the PA program, and they typically are coming with a commitment to go back and practice in rural areas. Many of these students also have Spanish language capability, and the goal of this grant is to recruit and then return Spanish-speaking providers to underserved areas in the state of Idaho and rural areas as well. So it's really a neat project that they've put together. Also part of this is training, looking at making sure that our PA graduates are adequately trained to deal with the opioid epidemic, which is another big problem across the state, but also in rural areas in particular, to be able to have access to the right kind of care. So there's lots of other news out there about the division, and you can look at our website, isu.edu/health sciences, and we have a news archive there. So as I said earlier, we'd like to get your feedback. We wanted to give you some information about our programs, but we also want to interact with you. So I'm going to hand this over now to Walter Fitzgerald to be able to talk through his slides, and then we'll have some time for discussion in a few minutes. Walter, do you want to pick that up and I'll advance your slides?
Thank you very much, Rex. Well, it's my privilege to have the opportunity to visit with our alumni and supporters today about news and events in the College of Pharmacy, and welcome to all of our alumni and supporters. So the next slide, Rex, if you would please. I put this slide here because I want to celebrate something, and that's the first line you see on the slide. In 2020, we graduated the inaugural class in Anchorage, Alaska. We began that program 4 years ago with the wisdom and vision of Dr. Paul Cady, who was dean, and then continued by Chris Owens as interim dean, and my privilege to announce that we did graduate that class this year of 6 students in Anchorage. Our total graduating class in 2020 was 79. with 34 students in Meridian and 39 students in Pocatello. Next slide, please. So I wanted to give you our current student statistics. Right now in the College of Pharmacy, we have 332 students, and you see them by class in the left column. So the class that will graduate this coming year in 2021, there is a total of 81. So as you look down the far right column, you see that our admission rate, our retention and progression rate is pretty consistent from year to year. And in an era in pharmacy right now where applications are down nationally for pharmacy programs by 25 or more %, the fact that we've been able to do that is quite remarkable and outstanding for the college. And it's due to the hard work of Dr. Brooke Buffett and her team in admissions, as well as all the faculty and staff in the College of Pharmacy. And not to forget, it's also due to our alumni, because our alumni and supporters are instrumental in referring students to us for admission into the College of Pharmacy. So thank you for all you do in helping identify applicants for our program. Next slide, Rex. So our entering class demographics. In my 40 years in pharmacy education, the one thing that I remember over those years is that the one thing that our practicing pharmacist alumni want to know about is the new class and all the information they can get about the new class. Well, time does not permit me to go through all the details here. This recorded town hall will be available, so you can go back and look later at all the details. But as you see across the top line, the total students again remains pretty consistent. I do want to mention about halfway down in the table, the ISU overall GPA. Once again, we are very pleased about our success in attracting students that show academic preparation that makes them good candidates for our program. So as you see, everyone with a GPA of 3.20 or above. And the other thing that is interesting in Idaho is that most of our students are residents, and that's the line right above the ISU overall GPA. So we do continue to have about 3/4 or so of our class is made up of Idaho residents. And then lastly, at the bottom, we do still have about a 50-50 split between male and female applicants that we admit. Next slide, Rex, please. The big news in 2020 is not COVID-19. It is that the College of Pharmacy celebrated its 100th birthday this year. Unfortunately, COVID-19 did have a little bit of an effect on our grand celebration that we had planned back on September the 11th. So we have postponed the Centennial Gala and other events associated with our centennial until September of 2021. So thanks to our very creative marketing and development officer with Leanne Waldron and Phil Yankovich, we have a new catchphrase for our centennial celebration next year, 100 plus 1 in 2021. So I hope that all of you will join us in September here in Pocatello as we celebrate 1 year later our 100th birthday. Next slide, please. The advantage of us having the COVID delay is that we have extended our Centennial Capital Campaign through December of 2021. The capital campaign was set to try to reach a funding target of $15 million. We have raised over $14 million of that $15 million and continue now to seek to reach that target. And I'll talk about something in a moment that I believe will see us realize that goal. There is a centennial patio that was created by Dr. Paul Cady and others with Phil Yankovich and building this, well, not them actually building it, them developing and planning it. It is under construction now, and it's on the back side of the building on the quad. And it is a circular design. There are pavers with names and donors' names. And so there are still pavers available. And if you're interested in purchasing a paver, either for yourself or in memory of someone, then certainly you can do that by contacting Phil Yankovich. Next slide, please. So one of the things that Rex asked us to mention was our COVID-19 response. In our community-based response, our students have been involved in a number of things. For example, our students in Meridian went to a distillery outside of Meridian, where instead of the distillery making its distilled spirits, they were using the alcohol to make sanitizer. So this was at a point early in COVID-19 when the sanitizer supplies were quickly taken out of retail environments by purchasing, and they were able to help with that. Now, obviously, immunizations. We have a major immunization event coming up the first week of October at the Meridian campus, but our students are gearing up now through Operation Immunization to be out in force throughout Idaho and up in Anchorage, Alaska, to provide not only influenza, but at whatever point COVID-19 vaccine becomes available, that as well. And obviously other vaccines such as pneumococcal to help make sure that we are able to manage disease this fall. Academic programs, well, COVID-19 affected all of our academic programs in one way or another. Our didactic courses, I will say, thanks to the fact that we already had multiple campus locations, distance learning was something that we've done for years now with faculty at one campus teaching across all three campuses. What we had not had much experience with was online examinations, but that also has gone very well under the leadership of Dr. Jen Adams in Academic Affairs, together with the department chairs, but also because of the faculty. The faculty have had to change their way of life quite dramatically over the last 6 months, and our faculty have just been outstanding in rising to the challenge. Experiential education, as I told Kevin Cleveland, our director of the Office of Experiential Education, he's probably got the most difficult job in the College of Pharmacy because of those sites that were not able to continue to take students because of COVID-19 precautions and for other reasons. So a lot of rescheduling, moving students around, but the success of that was borne out when every single student in the class of 2020 graduated on time. So the fact that we were able to work within all of our preceptors, and I want to once again give a shout out to our alumni, because many of you take our students on APPE rotations, and you were very flexible in working with them. Some of you took students when you had already previously said you did not have availability, but you took them anyway. So thank you for stepping up and helping our students graduate on time. And then our graduate programs, such as in BPSCI, that was a little difficult because of labs being shut down on campus, but those are now back open, and students and faculty are back in those research labs making great contributions to science and healthcare. And then in research and practice support, we've done a number of things there. For example, we just received a significant grant from the state of Idaho to place testing equipment and supplies in community pharmacies around the state of Idaho so that COVID-19 testing can be expanded, and particularly as that disease is managed in the state of Idaho. Next slide, Rex, please. Thank you. So one of the big items that we've been working on for the last year is the Leonard Hall renovation. If you've been in Leonard Hall, you know that its laboratories are not state-of-the-art any longer, not only as to the facility, but the equipment and the benches and the other things that make those labs state-of-the-art. So we have 3 options for renovation of Leonard Hall. The price range on these options is from $11 million to $15 million. And so the way that we are attempting to support funding of this renovation is through a major gift from the ALSAM Foundation. All of you know about the Skaggs Foundation and the Skaggs family, I should say, and the ALSAM Foundation. And the Skaggs family was very instrumental in the Meridian campus, in the name Sam and Aline Skaggs on the campus there. So that is who we have been working with over the past year to submit a proposal. That proposal is going to them this month, into October actually, and for a board meeting in November. So we are hopeful that funding will be received and we can begin the renovation of Leonard Hall. Our Centennial Capital Campaign, as I mentioned earlier, if we receive this grant from ALSAM, then that will get us well above the $15 million goal that we had set, by quite a few million above the 15 million. But the College of Pharmacy is also stepping up and contributing because of the generosity of our alumni and our supporters over the years. For example, the Wallace Fund and other endowments and gifts that we receive from our wonderful alumni, we are able at the College of Pharmacy to make a contribution of almost $2 million to this renovation because of you, the alumni and supporters, and what you have given us in past years. So again, another shout out and thank you to our alumni. I think, Rex, that may be my last slide. Not sure. No, I'm sorry. Development Advisory Board. The Kyle McGowan, our new Vice President for Advancement, has asked the colleges to begin creating a Development Advisory Board. So this is a little bit different than DAC, our Dean's Advisory Council, that some of you, I see Robert sitting there on our Dean's Advisory Council, so thank you for joining us. But so this is a little bit different. This is going to be made up of alumni, and it's designed to help us with funding for scholarships and other important initiatives. The Dean's Advisory Council will continue as it is, with some change in some of the focus and mission because of this other advisory board. So if you are alumni or supporter and you are interested in serving on either the Development Advisory Board or on the Dean's Advisory Council, please contact me. I would love to visit with you about that and hear what ideas that and interest you have and excitement you have for your College of Pharmacy. So I'm pretty sure now that is my last slide, Rex. Thank you.
Okay, I'd like to hand it over to Karen Neal now.
Okay, thank you, Rex. I appreciate it. I'm excited all of you are here, all of our alumni and supporters, and I'm always excited to talk about our newly formed School of Nursing. And next slide. I wanted to talk about demand. As you know, nurses are always in demand. And certainly in Idaho, we have a need for nurses in our urban as well as our rural sites. And so you can see with 27 critical access hospitals that there is always a need for nurses, as well as nurses in particular areas within facilities and ICU, emergency operating room. Our mission is to prepare our students, our graduates, to work to be exemplary leaders out in our rural sites and to reach our rural and diverse populations. So we really appreciate all you do as preceptors for our students and providing the opportunities for our students to be prepared to reach those populations, to take care of individuals, families, and communities, both in our urban as well as our rural sites. So always a demand for nurses who are at the forefront of healthcare and keeping us all healthy here in Idaho. I wanted to talk a little bit about supply. What we're experiencing right now and what we're seeing is that nurses are retiring, that many of our nurses are looking at retirement, and we are producing a lot of nurses, but we need to produce more nurses, particularly at the baccalaureate level. And as you see, we're lucky because we have a high percentage of nurses in Idaho that are prepared at the baccalaureate level, and certainly ISU is leading that in preparing nurses with the bachelor's degree when they graduate. So you can see we're always going to need nurses, and we will over the next decade and further be needing more nurses that are caring and competent and caring for all of us in the healthcare system. So I wanted to talk about our programs, next slide, and tell you some of the exciting things that are going on in the School of Nursing. As you know, we prepare nurses at the baccalaureate level. That's our largest number of student graduates every year. We currently have 168 undergraduate students preparing to be baccalaureate prepared. We have master's and doctoral programs. In 2014, we introduced our PhD in nursing, which is the only PhD in nursing in the state of Idaho. So we're really proud to have that here at Idaho State University. We have doctoral programs in family nurse practitioner and also in psychiatric mental health nurse practitioner areas. So we are graduating our students in doctoral programs, and I'm happy to report that we have 100% pass rate since the inception of those programs. Also, we're partnering with our community colleges to increase our numbers of baccalaureate prepared nurses. So we've been working on that in the last year, and our BS completion program is growing. We're also looking at bringing the accelerated program, and that's a program where nurses come in with a degree in something else. And we get students with degrees in biology all over the map, and they come into our accelerated program, which is now on the Meridian campus, where we increased to 50 students this year. And they graduate with a baccalaureate degree in a one-year time period. So we're looking at expanding that program to the Pocatello area, Idaho Falls, Twin Falls area. And then I just wanted to let you all know and appreciate your support. We have just received notice of our accreditation of our programs. Our baccalaureate and DNP programs extended to 2030. So that's the maximum amount of time for accreditation, and we're really pleased to let you know that we're fully accredited, and we'll continue to prepare competent and caring nurses for practice. Next slide. I wanted to share with you a couple of highlights, student highlights. This is Sammy Fayal. She's a DNP family nurse practitioner student, and she just received a scholarship from Nurse Practitioners of Idaho for her DNP project, where she'll be educating some of our refugee population in the native language so that they can better navigate the healthcare system. Our students are doing projects across communities in all of our programs, undergraduate as well as graduate students. And again, we really appreciate your support in opening doors for us and for serving as preceptors and mentors for our students. These are just highlights. Many of our students are receiving small grants to complete their projects, and we certainly like to see them on the national spotlight on their work. Many are publishing their work in peer-reviewed journals, and they're doing this learning out in our Idaho communities. Another student highlight, we just received word that Ben Jancy is receiving a National Health Service Corps scholarship. He is, with this scholarship, receiving full tuition and educational expenses and a monthly stipend, and his goal is to work out in a health professions shortage area. And we currently have 46 federally qualified health centers in Idaho, so he'll have some to choose from there. So we're excited. He just heard about this award, and we're excited to share that with all of you. And this, again, Rex asked us to talk a little bit about COVID impact and response. This is Melody Weaver. She's one of our faculty. She is currently actively participating in on-site COVID testing here on the ISU campus, and we really appreciate her work. Our students are, it's amazing, our facilities, our hospitals, our clinics have really, they've opened the doors and kept the doors open for our students to come in and complete their clinical rotations, and have helped us to prepare the students with the PPE necessary to protect their safety as well as the faculty. So we've appreciated the support of our hospitals, our clinics, and providing that experience for students in light of this COVID pandemic. So they're very dedicated and committed and to providing care in this pandemic, and appreciate that the hospitals are supporting, our clinics are supporting their continued learning opportunities. And there's a couple of questions that we'll answer at the end. Some were directed particularly to nursing, and so I will answer those at that time. These are some of our students in our sim lab, and we've done some virtual simulation with the pandemic, but we are also utilizing our sim lab following the CDC guidelines. So they're wearing masks and social distancing, but they are learning in our sim lab here. And many of you as donors have helped us to continue to provide the necessary equipment and supplies for our sim lab learning. And as you see the smiles on their faces, they really enjoy working in that particular area. So thank you again for being here today. Thanks, Rex.
Well, I also consider it a privilege to be here with each of you today, and I'm happy to share a lot of exciting information about our school. We have a lot of faculty, a lot of students, and so my kind of take on this, I wanted to share some highlights about each program that would help, I think, hopefully give you a snapshot. There's obviously so much more we could go over, but this will give you a snapshot of our excellent programs and who we're educating. So we talk a lot about our students, obviously, that's why we're here. We have a lot of undergraduate students, about 260, and then about 360 graduate students with some fairly new PhD students. So they're involved in so many different activities, from classroom to service to clinic to research. So great students in our programs. So first I wanted to start off with the physical therapy program that's located on both Pocatello and Meridian campuses, 144 students and then 12 faculty to support that work. In 2018, there was a expansion in Meridian, and they enrolled their first class of 24 students, and that's continued in 2019 and then 2020. So there's a full complement of those 144 students between campuses. The faculty and students are very involved in research. There's some pretty amazing virtual reality-based therapy that's been going on. And then one of our faculty has it's called the Rock Steady Boxing Program for people with Parkinson's disease. So these are just two of examples of the research that's going on in physical therapy. A highlight, and this is something I'll highlight as we go through each of these, but great in-house clinics to prepare our students for their clinical practice. And on top of that, as already been mentioned, we couldn't do what we do without all of the help and support from our externship sites, the preceptors. So thank you to any of you who do that for any programs. I mean, I know we say that, and I hope we back it up with our gratitude in other ways, but just could not do it without all the help that we get from our alumni and then our community partners. So OT, I was also in the PTOT department. So there's the Masters of Occupational Therapy program, currently 50 students with 4 faculty. Kind of following in the footsteps of physical therapy, Meridian expansion will be happening for OT as well. And as Rex mentioned, there's some new faculty hires, searches going on. And over the next 3 years, the hope is to increase that enrollment up to 120 students between both the Pocatello and Meridian campus. A pretty big highlight for the OT program was hiring of a new program director this fall, Barbara Kornblau. She comes with an exceptional record of scholarship and service. She's an occupational therapist, but has done so many other things. So she's nationally known and just jumping right in, and is going to be instrumental in helping with the expansion to Meridian and leading that program. So same thing with occupational therapy, great in-house clinics, and then those externship experiences that are so critical for our students and their clinical growth. So speech language pathology, this is I think our biggest program in terms of just students, faculty, and work that goes on. And I'll tip my hat to Tony, who's on the call, I believe, who was truly a visionary and a boots on the ground contributor to a lot of what I'm going to talk about here. Without Tony, I seriously don't know where we'd be. So thank you, Tony. We have students on Pocatello Meridian campus, plus there's a master's students online cohort and also an online pre-professional post-baccalaureate program for both audiology and SLP. So that's where the majority of those undergraduate students come from, is in CSD. There's 140 master's students in the SLP program, supported by 18 faculty. And I wanted to highlight the Scottish Rite Foundation that Rex mentioned earlier, that's partnered with our clinics. It's been a great partnership, I believe, since 2018, providing some financial help for speech language services for children, and also those scholarships that Rex mentioned. So we're so fortunate to have partnered with them. There's also, again, a lot of research happening in the programs. Just a couple to highlight here. Chris Brock has been working with augmentative and alternative communication and animations and enhancing communicative outcomes in children. And then Christy Blazer and colleagues have been doing some great work with teleintervention and technology, especially with our early intervention, newborn hearing screening, children that are deaf and hard of hearing, to optimize clinical outcomes for those children. Same thing with the clinic, a lot of specialty clinics. These are just, again, a snapshot. We have many more clinical opportunities for our students. So sign language studies and interpreting. Students can earn a Bachelor of Science in Sign Language Interpreting. That's over on the Meridian campus, where 3 of our faculty are located. There's about 20 students in that program now. Or Associates of Science in Sign Language Studies, they can earn that degree as well. So we have 1 faculty here in Pocatello and 3 in Meridian. Recent accreditation was a highlight. That's been a great recognition and a huge step for that program. And then maybe some of you have met Stephen via watching the news. Stephen Stubbs is one of our faculty that's been doing a lot of the interpreting for sign language for the governor's office, especially during COVID-19 and other things. He's Idaho's only certified deaf interpreter. So it's quite an amazing process. You don't see it all happening when you just view Stephen, but there's a lot happening that makes that possible, and such a valuable service for those individuals who need that interpreting service. Audiology is also located on both Pocatello and Meridian campus. A little different than SLP, we don't have separate cohorts. They start in Pocatello and transition to Meridian. Currently have 28 doctoral students. Undergraduate students also make up part of those undergraduate groups for CSD. Currently 7 faculty contribute and support. So this is one really cool, and we think always nice to highlight, is the Canine Audiology program that's been going. So not only do our students get really good quality, human clinical training, they also have a chance to work with the canine population. It's a pretty neat, innovative opportunity for the students, and a great service to many of the people that need that. One thing I'll highlight with audiology is student engagement. That's one thing that we've consistently seen in student feedback, is that they really appreciate the faculty's expertise, their accessibility and connection. And I'll just quickly highlight Luz Oriana's story. Luz was born in Guatemala, grew up in California, and then decided to be an audiologist. She was looking at our programs, and one thing that stood out to her, she said, as she had her different options, was that when I contacted ISU, faculty talked to me. They engaged with me, they listened to me, they talked with me about what I wanted to do. And she said that was really one of the main reasons why she decided to come to ISU. So she's been successful in competing for and being accepted into a minority leadership program through our national organization, and some other awards as well. So she's a great example of that student engagement. Our audiology clinic has kept going through COVID. We had to reduce our services a little bit, but we're still going. I will highlight back to SLP. SLP services are still going, but on a different way. We're engaging with telehealth, predominantly to help our students get the hours and the experience they need. And then lastly, this is again a tipping hat to Tony as well, because he was a big part of this, but a lot of faculty and work went into creating the PhD program in rehab and communication sciences. So students can engage in that from Pocatello, Meridian, or online. Currently have 6 students enrolled. It's a very collaborative effort across our school and the division and ISU. One highlight we think is really great about this is it's very individually tailored to the students' needs. And these faculty, these students come from all over to engage in this program. And we are grateful that it's up and running, and look forward to continued success with that program. So that is a very quick and nice overview of our awesome school and students and faculty.
Thanks so much, Chris. Appreciate it. We do have time for a few questions. We're almost right up to our 2:30 time period, but I think some of us can stay for a few minutes afterward if people have questions that we don't get answered. I appreciate Walter, Chris, and Karen and their updates from their units. The Division of Health Sciences, as you've heard, is pretty big, and a lot going on, a lot of students engaged, and a lot of effort going in to making sure that those students are progressing through their degree path in their chosen field.